Hi, Evelyn. How are you doing?
I'm doing pretty good.
All right. Well, it's great to see you again today.
It's good to see you too.
Well, I'm glad you came in for your cleaning today. The hygienist was telling me that you have some sore gum tissue on the right side. And I was just curious, has that been bothering you when you've been brushing or flossing over in that area?
Yes.
How long do you think it's been going on?
I'm not sure.
All
I'm
right.
not sure. Maybe. I'm not sure.
That's okay. I'm just glad you're here so we can focus on that. I saw in your health history that you had been in the hospital recently. What was that for?
Um, I'm not sure. I'm not sure. They didn't tell me what it was for.
Okay. What was it serious? Are you doing better now?
It had it had to do with my diabetes,
Okay.
and I think it did. But
Okay.
I'm doing great.
You're feeling better. Just that gum tissue's giving you some problems, huh?
Yes.
All right. Well, this conversation reminds me of something that I've noticed, that you've been having a change with your memory when we've talked a couple of times.
Uh-huh.
And I was just wondering, is that something that you've noticed? Have you noticed a change with your memory lately?
Mm, not much. No, I haven't.
Has anyone in your family told you that they've noticed a change with your memory?
My son says I forget things or say things again.
Okay. Well, I'm going to do your dental exam today, and I was hoping that if he's here, I think I saw him come in with you today. Is that correct?
Yes.
Yeah, so after your dental exam, I would like to ask him to join us for a conversation just to get his input to hear more about what he thinks of your memory changes. Would that be okay if we do that?
Um, I don't think I need it.
Well, I've noticed that you have a change, and I just am worried about your health, whether it's your teeth or your brain. It's my job as a clinician to make sure that my patients get the care that they need if I have a concern. And so it would just take a few minutes after your exam if we could ask him to give his opinion, and I'd like to talk to him too. Would that be okay?
Yeah, I guess that'd be okay.
All right. Well, let me get my gloves on, and I'll get that dental exam for you, and then we'll have our conversation.
Okay. Sounds good.
All right. Travis, thanks for meeting with us today.
No problem.
It's good to see you.
Good to see you too.
Yeah, the reason I had you join our conversation today, during your mother's dental appointment today, I was a little concerned that she was having some memory changes based on the questions that I was asking her and the way she was answering them. And so I just wanted to know your opinion. Have you noticed changes at home as well?
Yeah, I've noticed some changes. Sometimes when I call and schedule appointments for her and tell her I'm coming to pick her up, she forgets I'm coming. She forgets things around the house. So there's been some things I've noticed.
All right. How long has it been, do you think?
Probably been about a year.
All right. And Evelyn, is that something that you've noticed as well now that he mentions it?
Yes, I have noticed.
Okay.
Forget things.
Yeah, well, I mean, it's something that we both have noticed and definitely want to do something to find out what is causing this change. And so that's what I want to talk to you about next, is that, sometimes it could be something as easy as a vitamin deficiency, changes in mood or sleep, or even an underlying medical condition. And in some instances with treatment, it's reversible, and sometimes there's medications that we can give that can slow the process down. And so that would be great, but we first have to find out exactly what is causing the memory change.
Okay.
Yeah, so what I'm proposing is that you contact your physician, your primary care physician, to set up a memory evaluation. And what works out nicely is if you would also go, Travis, to put in your input, and that way they can talk to both of you. And then what I'd like to do is also give my observations and some of the information that we went over today. Would that be okay with you if I contact your physician?
Sure. Yes.
All right. And so, yeah, so I'd have you contact the physician to set that up then.
Okay.
Yeah, I think that would be a great start to find out what's going on. And before you leave, there's just a couple other questions that I would like to ask you. And I want you to concentrate, because I'm going to give you 3 words, and then I'd like to repeat those 3 words back to me.
Okay.
So listen carefully. It's leader, season, and table.
Leader, season, table.